Hi everyone. This will be a short video where I will talk about what kind of work I do. Because unlike general plastic surgeons, I perform very specific surgeries. Therefore, patients sometimes get confused about the surgeries that I undertake. There are even patients who think I am a urologist, but that's not the truth. I'm a plastic surgeon. I have my private clinic since 2000, but over the last 10 to 12 years, I have specialized in specific areas. I do not perform just any surgery. For instance, I do not perform rhinoplasty, no surgery. I am performing the types of surgery which have always interested me since my residency. And among them, for example, male genital aesthetics. This is the type of surgery that I most frequently perform. Penile enhancement, testicular prostheses, correction of penile curvature, etc. I also perform silicone implant placement surgery. For example, surgical interventions for crooked legs, hip augmentation with buttock implants, cosmetic surgery for the breasts, including augmentation, but also reduction, breast lift, reconstruction. Moreover, I also perform pectoral implant surgeries for men, particularly bodybuilders. There are also specific surgeries that most plastic surgeons don't deal with, but I love these cases. Since my residency, I have always researched such cases, collected and read articles on them. I have had the opportunity to undertake them after establishing my own clinic. For instance, bichectomy. I have been performing bichectomy surgery for a long time, but since 2010, it has become very popular. I have been frequently performing bichectomy since 2000. This is the removal of excess fat from the cheek. I also perform tongue reduction. When I talk about it, many colleagues say they have never heard of it. Indeed, many patients demand tongue reduction surgery. But most surgeons have never heard of it, or they don't want to deal with it. What is the goal here? Well, some patients are born with a large tongue. The tongue protrudes beyond the teeth, causing a malocclusion. Or sometimes the patient's tongue is always out and the patient bites his tongue while talking. Then there are patients suffering from acquired macroglossia. They do not congenitally have a large tongue. For example, a patient suffering from lisp visits a speech therapist and is given exercises. These strengthening exercises lead to the enlargement of the tongue. Then the patient's molars start to bite his tongue while speaking. He complains his tongue is grown. All these patients need tongue reduction. I do perform this surgery. I have performed reduction glossectomy for congenital and acquired macroglossia, both children and adults. I have ample experience. I also perform surgery for drooling treatment. As far as I know, there is no other surgeon in Turkey performing drooling surgery. A surgery that no one is much interested in. Well, what is it? It is most commonly performed for spastic children with excessive spillage of saliva. These patients constantly drool, they have to wear a gown all the time, and aren't even taken out of the home. For these patients, we perform a drooling-reducing surgery to prevent saliva outflow. A specific surgery requiring customized planning for each patient. It is necessary to first examine the patient and create a tailored plan. I am very experienced in drooling surgery, and it is most commonly performed on children. In addition, I frequently perform tracheal shave for reducing the Adam's apple, the excessive protrusion of the fracture in the larynx. This can be very noticeable in some people. On whom do I perform tracheal shave? I've had both male and female patients who wanted their Adam's apple reduced. Also transsexual patients may want it removed. This is an interesting operation. It's not very common because you need to totally listen to your inner voice while removing the cartilage. If you remove more than necessary, the patient may suffer from hoarseness. Fortunately, I've never had such a problem. For this surgery, I shave the cartilage, and after a while, my inner voice tells me to stop. The excessive protrusion is gone, no need for further leveling. At this point, I stop. No clear-cut criterion for this. It is really an interesting operation. If you shave the cartilage more than necessary, the support for the vocal cords in the larynx will weaken, leading to hoarseness. So much skill is required to know where to stop. To be frank, this is something directly related to experience. no clear-cut criterion. It is impossible to see the inside of the larynx and how much has been shaved. Fortunately, I haven't had a problem and I hope I won't. By the way, I did encounter patients suffering from hoarseness. It's an unfortunate situation. But an interesting surgery apart from this risk. There are patients who need it, but no surgeon undertakes it. I, on the contrary, like such interesting surgery. I have no interest at all in rhinoplasty. As I've said before, I have not performed rhinoplasty in the last 12 years, and I really feel relieved. Rhinoplasty is a surgery where everything is not under your control. You may reconstruct a perfect nose with cartilages balanced and beautifully shaped, but it takes a year to heal. Throughout that 1 year recovery, the tip of the nose might bend downwards or sideways, or when the edema heals, a bone spur may appear. The patient may need a revision. I don't like this type of surgery, but everything is not under my control. That's why I stopped doing rhinoplasty about 12 years ago. I gave away the relevant instruments to colleagues, so I do not undertake rhinoplasty. I do liposuction, abdominoplasty, and breast reduction surgery. These are common general surgeries. All plastic surgeons do them. I also do facelifts, not as frequently as before, yet since 2010, male genital aesthetics cases have increased in number. Then, the more often you do a type of surgery, the more experience you get. What happens then? Patients are more satisfied. They leave with better results. You are well known and more patients contact you. So after a while, you become the expert of the field. That's why I still do facelifts, but to be frank, since 2010, much less frequently than before. I used to perform hair transplantation. I was working with a transplantation team, but I left them. When I receive a hair transplantation case now, I do perform the operation with a team. Such cases are rare. I do not currently work on hair transplantation as often as before. So as I've said, I most frequently undertake silicone implant surgeries, insertion of breast prostheses, interventions for crooked legs, hip augmentation with buttock implants, pectoral implants for male patients who want a muscular chest, and most frequently, male genital aesthetics and penile enhancement, then some very specific surgeries, like, drooling surgery, tongue reduction surgery, tracheal shave, bichectomy. So, liposuction, breast prostheses, calf prostheses, buttock implants, male genital aesthetics, penile enhancement, testicular prostheses, etc. Thanks for tuning in. I would like to emphasize once again, I'm not a urologist, no such thing. I'm a plastic surgeon. I simply wanted to underline that. Well, thanks. See you next time.